Nachiket Mohan, thank you very much for joining us here on CNBC TV18. When Bill Gates was in India, he said that he was very optimistic about India and his optimism lay really in the potential of technology, digitization, and the impact that could have to make lives better. And the recent report that you've come out as part of your goalkeepers report, it kind of sort of reaffirms that the power, the technology, the role technology, financial inclusion can play in empowering people, especially women. Talk to me a little about this.
No, clearly the optimism of our co-chairs, Bill and Melinda, about India, that of the foundation itself, is very much founded on the ability of Indians, both to harness our human potential, all the fabulous capability that we have, as well as all the technological capability that we have in finance, in healthcare, in sanitation, in tuberculosis, in the management of vaccines. And clearly there is a sense that we have that India, by using its unique capabilities, can chart a pathway that is unique and that helps us get to its goals. Finance is a good example. The ability that we have to use the mobile base that exists, the ability that we have to use very modern technologies for clearing money between individuals, be it the BHIM application, be it the Aadhaar framework that we have put in place. These are unique to India. These are strengths that India has. And certainly by putting them to good use, our belief is we can have a material impact. One of the areas that I would like to draw your attention to is projects that have been done that show that, for example, if we are able to transfer money into a woman's bank account, she thinks of herself in fundamentally different ways than if she did not have that bank account with
So the sense of empowerment that comes in with that. Yeah.
Sense of ownership, the sense of agency that she gets is very different. And clearly that can have a material impact. And digital finance is cheaper, more accessible. We can allow it to go deeper into the hinterland and make the whole transaction much smoother and much more accessible.
Because I think the example that the report gives is about Banerjee and saying that, as part of your control group and the study that you did, if the money gets transferred in the bank accounts of the women, and that's where you see. But why is that the case? And do you feel that technology, financial inclusion can also slowly break the cultural barriers, which is clearly a big impediment for large-scale involvement of women?
Clearly, we believe finance and financial access has a link with gender empowerment and gender equality. Is it enough of a link? Is that what will answer the question of breaking cultural barriers? Is that enough as a direction to go? It's hard for me to say. It'll clearly help. That's what the evidence is saying.
The big sort of pillar of this government's governance so far has been, direct benefit transfer, so that there is no leakage. Rajiv Gandhi had very famously said, 15-20 paisa of 1 rupee actually goes to the people for whom it's intended, and that is the leakage that the government is trying to plug. Is Bill and Melinda Gates Foundation working on any of this, for instance, direct benefit transfers?
We have a strong interest in digital financial inclusion, but we believe that the power of digital capability will make that happen much more quickly, much more cheaply, and in a much more accessible manner. One of the powerful levers that the government has that can enable that is, instead of using traditional channels, cash-based channels, to do whatever transfers it wishes to do to low-income households, if it uses digital channels, we think it can do this much more quickly. It can do that with much less leakage and ensure that if the benefits was targeted to women, then women actually get it. But there's an added opportunity, which we think is something that digital finance can unlock. That if you design subsidy schemes for LPG, for fertilizer, right? And the only way you have to make that available to people is through product supply. Then sometimes you build a linkage with the product that might not be in the best interests of the underlying user. Right? If you're able to decouple the two, right? So you buy LPG at market price, but the subsidy that should be given to poor people goes directly to your bank account. Then you don't distort the underlying market for LPG, but you make sure that the subsidy is available to you. In fertilizer, if you give the subsidy directly to the farmer, he can use the fertilizer that he needs appropriately, not overbuy a cheaper fertilizer because it's subsidized.
Rather than moving away from subsidy-led model, you transfer the money directly into their accounts and then leave it to them how.
And that allows you to build better markets. It allows you to build better usage behavior. So it helps the cause of digital financial inclusion. But our belief is it also allows the system itself to perform much better.
So fundamentally then, your foundation agrees with the government on this front at least that that this is the way forward when it comes to dispersal of or come up with specific schemes targeted for the poor. We need to have we need to use technology as a plank to sort of serve them better, which is where Aadhaar and all of that comes in. So fundamentally, you're on page with this government's view?
We clearly believe that digital finance, digital access allows you to move resources with minimal leakage, with fairly high speed into direct beneficiaries. And as we discussed earlier, if women get money into their accounts, if they feel like they have resources that are entirely their own, there's clearly a link back to empowerment.
Let's talk about healthcare, because that is one area that you've tracked very closely for so many years, Mr. Nachiket Moore. And India's health spend is about 5% of GDP. That translates it, which is what you have illustrated as about $260, $265 per person. And that clearly is not adequate. When we compare India to Ghana, we are far behind. We are below 140 out of 188 countries when it comes to the SDG goals as far as healthcare is concerned. What is the problem? How do we? If government increases their overall spend in healthcare as part of our GDP, will that solve India's healthcare problems, or are there deeper issues that that you can talk to me about?
So as we spoke about earlier, India has unique capabilities that it can put to good use. Our belief is that as a country, we are spending less than perhaps developed countries are, but it's not inadequate to provide services. So this 5% number, the point we make is countries that are spending less are able to do a good job. Countries that are spending similar amounts are able to do a good job. So the absolute amount of money itself is not a barrier. It could certainly be more, but it's not a barrier. The challenge is, how is that money being spent? Where is the money coming from? In India, unlike in other contexts, a lot of that money is coming on what we call out-of-pocket basis. That is, when I need the service, that is when I carry a wad of cash in my pocket and I pay for it. If I go to a hospital, if I go to a doctor, if I have a surgery. The global evidence is this is a very bad way to spend healthcare money.
That's where you've also said between 2004 and 2014, 5-6% of people have actually fallen below the poverty line because of out-of-pocket expenses.
Every year, not
every year
in the decade. Every year, 4 to 5% of the population goes below the poverty line, or those that are already below fall further below. But this number is actually people that were above fall below. So in some ways, if the country has a goal of eradicating poverty, completely wiping it off the face of the country, and we are, say, at about 20% now, every year we start with a handicap, because that number goes from 20% to 24, 25%, right, and then again we have to bring it back to 20 before we can bring it back further, right? And A lot of this has got to do with the manner in which money is being spent.
Right.
Not necessarily the absolute expenditure.
That's right.
Right. But if you, for example, suddenly have to come up with 3 lakh rupees to pay for a surgery, right?
How do you address that issue then?
So the manner in which many countries have addressed it is through pooling.
Yeah.
So all of us in some way, either via taxation or via some other mechanism, right, we end up contributing to what we need towards our healthcare in a smooth way. Right? Either I pay my taxes, and therefore that is the ideal way. The government uses tax resources to then make sure that healthcare is available for free to everybody, which is what we call the universal healthcare model. Government might say, well, I don't have that kind of resources just now. I have many more priorities. Right? Is there another mechanism that can be used? Right? In India, we have, for example, the employee state insurance scheme.
But that's again for people,
it's for blue-collar workers.
Yeah.
So blue-collar formal workers.
Yeah.
It's a contributory scheme in which it doesn't use tax resources. People, the worker pays some amount, the employer pays some amount, goes into a pool, and that is then used to pay for healthcare services.
Right.
So these mechanisms obviously need to be expanded
to the unorganized sector,
to the whole country, either via taxation or via some other mechanism of this nature, so that when I need a 3 lakh rupee surgery, I'm not paying 3 lakh rupees right from at that point on an out-of-pocket basis, but I get the surgery that I need. I may pay an annual contribution as 5-10% of my salary, or I may pay taxes if I'm in the tax net. But those are the mechanisms that are being used to finance the overall healthcare system.
What is the role price control can play in this regard?
So now one could argue that what are the various mechanisms governments use to ensure that healthcare expenditures are reasonable, right? What we find is that if I look at it globally, no high-performing health system works on a purely market-based approach. If I take, what I would call openly market-based economies, Switzerland, Japan, for example, right? Germany, right? The actual price that you pay at the point of care, anybody pays, whether it's an insurance company that pays or you pay, is one way or the other controlled. Either by a price negotiation that happens across the entire
across
system,
the country.
Across the entire country.
Okay.
So an example is that of Japan. Every year or 2 years, there is a negotiation industry-wide. And right from the price that you will pay for a square inch of bandage to an overnight stay at the hospital is negotiated.
Does government subsidize these hospitals?
Well, it depends on if you're a poor person, are you a paying person, what is the mechanism through which, is it the pooled mechanism like employee state insurance, or is it taxation that is paying for it? That's a separate conversation, how people pay for it. But what doctors and hospitals get paid is agreed to on a zero subsidy basis between the government and the provider. And then this is published in the form of a book that is available in every waiting room of every doctor, every hospital, that tells you how much will you pay.
So they impose price controls on hospitals, on doctors, on medicines, because a whole retinue of things.
And not just medicines, all services. So
all healthcare related services.
Yeah, it's not simply that only price control is there for medicine.
Irrespective whether it's a public hospital or a private hospital.
If you want to be a part of the system, you must adhere to this approach. And I would say price control is one mechanism. Even in the US, which is much more open-ended market economy, there is benchmark pricing.
Right.
And private sector then operates around that benchmark. It has play, but not infinite play. It is around a certain benchmark that is set.
And this is a model that India can look at closely. There are lessons to be learned, and by taking the price control regime that they follow there, and have a similar sort of a system here in India.
I would argue to you one step further. I do not believe there's any other way of doing this. One way or the other, we have to do pooling, what we discussed earlier. One way or the other, we have to find a way that prices that are charged in the system are set using some mechanism. I'm not arguing to you that the government wakes up one morning and just announces a price. It may be a negotiation, it may be a panel that decides it, But there's clearly no choice but to introduce some form of
price control,
standards
ceiling price,
or some mechanisms by which prices are not decided by a free market process.
All right, Nachiket, let's just quickly slip into a break on that note. Our conversation with Nachiket More continues when we return. Please don't go anywhere.